And I'd like to specifically invite you to take consideration of joining us in our advocacy movement. We engage the state legislature and the executive branches. You, as the next generation of judicial advocates, will be excellent voices in fighting the drug war and restoring human rights. We want to be very comfortable. We're going to have a very casual conversation-style discussion with our main speaker, and then we're going to move on to our expert panel, which we have speakers from the ACLU and Families for Sensible Drug Policy, and then we're just going to hold the questions and answers until afterwards. So you're going to kind of get both sides of the coin. You're going to hear about the successes of Portugal's drug decriminalization policy, why they have not even a fraction of the overdoses that we're experiencing here in New Jersey, even though they've relaxed drug laws. And then we're going to talk to people who have researched the harms of drug criminalization here in New Jersey and across the United States.
Thank you, Randy. I hope you don't mind that we actually opted not to have João at the podium, but rather have a more casual conversation about the Portuguese experience. So let me start by asking the following. You now have traveled in the United States a little bit. We actually came back from San Francisco, where the problem of homelessness and drug use is incredibly visible. I don't know that it's worse or not than it is here in New Jersey or New York, but it's incredibly visible. And you've heard about the opioid crisis. So we sort of find ourselves in a moment where drug use, drug overdose are a major issue for citizens, politicians to engage around. Can you talk a bit about what it was like in Portugal 20 years ago, particularly if you do see some similarities of what we are dealing with right here?
Okay. Good question. Well, first of all, thank you for organizing this meeting and having me here. It's a pleasure to join you and discuss. And probably to walk a little bit on some myths that are still present around the Portuguese policy. As to your question, well, the answer is yes. I see a lot of similarities with the situation that you are facing here now with ours 20 years ago. In fact, you lived heroin crisis a couple of years ago, a couple of decades ago. We lived it later on. But the difference between those epidemics was that 1 year the epidemic of heroin spread mostly among marginalized people, spread mostly in the ghettos. In my country, due to historical conditions, it spread all over our society, in all social groups. And as far as I can see now, this new opioid crisis is attaining all social groups in the state. So it's perhaps the momentum of speaking about the more inclusive kind of policies that are made possible because, well, when things are confined to the ghettos, to minorities, it's probably much more difficult to have a social movement towards inclusion and to health-based policies. In this moment, I think that it is probably a window of opportunity for you to think about new approaches and to move into a more humane kind of policy. So I think this is the right moment to do it.
So can you share with us a little bit of what was it like 20 years ago? You know, what was it in fact that inspired your government to sit down and say, okay, we're going to do it differently?
Well, we lived special historical conditions, in fact. You probably know that we lived for a long time under the dictatorship. Salazar maybe sounds you. For 50 years we lived in a very close society, very controlled society with a very severe political police, censorship, and some of the movements, some things that happened elsewhere did not touch us. We were completely isolated. For instance, the hippie movement had no importance mechanism. The students' movement in France in the late 60s did not touch us. We were kept apart of all that by the censorship, and it was almost impossible for us to travel abroad. We were not a very sexy destination for tourism either, so we lived there isolated. And during that period, we had almost no problems related to drugs. They were not available. There was no market, any kind of market for drugs, except some access to opioids by health professionals, for instance, in hospitals and so on. But it was not a massive problem. But meanwhile, in the last years of our dictatorship, we were dealing with a colonial war in our ancient colonies. Angola, Mozambique, Cape Verde, Guinea-Bissau, we had a huge number of colonies. And most of our young male population was sent there to serve as soldiers in that war. And down there, a little bit like the Americans in Vietnam, drug use was tolerated or even incentivized. So suddenly in 74 we had our democratic revolution, and shortly after the process of decolonization and the return of all those soldiers and settlers from the ancient colonies, so 1 million people coming back to mainland. We are roughly 10 million, quite stable, so just imagine 1 million people coming back with their habits and bringing tons of substances to be used. Therefore, suddenly were made available for everybody. And for those who were there, I was 20 at the time, so I lived it in person, there was a kind of curiosity for something that came with freedom and was a revelation for everybody. Shortly after, all substances were available in our market. So heroin, cocaine, LSD, along with cannabis. So, and we were completely naive about drugs. So it was easy to shift from one to the other without even understanding that we were dealing with different things. And just in a decade, we had a huge number of problematic users, mostly hooked on heroin. Okay? While in other societies we could see that, mainly European societies, we had a lack of total use of substances and a much lower lack of the prevalence of use of substances, and a much lower line for problematic use. Among us, it was a very narrow gap, almost as if everybody who was experimenting drugs became addicted and problematic. So, and it spread literally among all social classes. This was not only among marginalized people, minorities, so everybody started to use. And every family started to face problems related to drugs. And people started to think a little bit, the proximity led to it. Okay, my boy is not a criminal. My boy is someone in need of help, in need of support, in need of health care, and will not benefit for being put in jail. Instead, he will come much worse from that experience. And that was a kind of mindset, a kind of, I would say, a bottom-up movement towards decriminalization. It was not a decision of some illuminated politician or whatever. I was introduced as the architect of this policy. I'm not the architect. I'm one of the workers, not the architect, and I don't want credits that I don't deserve. But we had some key actors and political actors at that point. The problem was becoming the first concern of the Portuguese people. The problems, the drug-related problems. Because, don't forget, so we are talking about 70s, the late 70s. Our democratic revolution was in 74. So the 80s, HIV, AIDS came along to complicate things, and it started to spread and to devastate a generation of people. Overdose deaths were happening everywhere. A huge visibility of the phenomenon with the open scene consumption. You could see people injecting everywhere, syringes abandoned everywhere. Criminality related to drugs also. Petty crimes. We never had a violent, big criminality related to drugs. But that small criminality, pickpocketing, taking your purse, if you are a lady on the street, someone would take it and run. You could not believe anything in your car because someone would break the glass and take it. Well, really increasing concern of our society. We started to develop some health responses to deal with it. But things seem to get worse every day. So by the end of the 90s, in 97, 98, it's important to talk about some actors. Our Prime Minister was the current Secretary General of the United States, of the United States, no, of the United Nations, Antonio Guterres. And he was quite close of the problems. One of the reasons is that his sister is a psychiatrist that worked with me in the treatment centers in Lisbon. So we had direct access to him, and we discussed several times what to do, how to deal with it. We could not reach, we had no critical mass to do it. So it is very to convene a group of people, a group of experts from several areas, from judges to doctors, psychiatrists, and other kind of doctors, psychologists, social workers, a group of 9 people, among whom I was included. And what we have been asked is, okay, please make a report on the Portuguese situation and propose a strategy. How can we address it? And we needed that strategy because the responses that we were offering were quite pessimistic and diverse. I had, at the time we had some private responses, NGO, religiously oriented, some of them quite problematic in terms of human rights respect. We needed a clear guidance and a clear strategy to deal with it. So, that group that I was included, we proposed new ways to address prevention, also the supply side, but mostly the demand side. Prevention, treatment, harm reduction, reintegration of people. Everything based in the idea that we were dealing with a social and health condition rather than a criminal one. And accordingly, we proposed the decriminalization of therapies. And the decriminalization of all drugs. Okay? Of course, we had a discussion, what, only cannabis, or are we going to propose the decriminalization of everything? And the rationale behind it was, okay, what really matters is the relation that the subject establishes with the substance and not the substance itself. So, let's go on that.
So we have, so I think those of us that look at sort of across the world and look for best practices when it comes to drug policy know Portugal for the decrim approach. But can you talk a bit about sort of how does decrim fit in the larger policy and why it's important that it's there in the context of larger policies?
Yes, in fact, we were developing responses, mainly in the health side, in the health service, but there was a kind of, there were some contradictions in the system. For instance, we had a syringe exchange program, quite innovative because it is based on communitarian pharmacies. We have syringes available for the exchange in every corner pharmacies. They are delivered for free, they are provided by the state, and people can go and change. And in the centers, in the treatment centers, we have syringes available. But I remember being a doctor working with these problems. I remember that it was somehow strange for me. How can I, working in the name of the state that criminalizes, provide the tool to this person to commit his crime? That was something strange. And we needed also, we had, the state was investing at that time, by the end of the 90s, was investing in new centers, in new facilities for the treatment and so on. But we had the feeling that first, in preventive work, we were spending a lot of money in media campaigns, in spots on TV, completely useless, with no impact, or with the opposite impact, if any, okay? On treatment, we could not agree, even among us professionals, we could not agree about the use of methadone substitution treatment. Okay? Buprenorphine. So some of us were very much in favor, but others, we are moving, shifting from one dependency to another. You know that kind of argument, maybe. And so on. So we needed a clear guidance. So it was important to have clear assumptions on all those mission areas. For instance, harm reduction, what is it? Are we incentivizing people to keep on using? No, in fact, our framework is harm reduction is a set of policies in order to consider that even if a citizen is still using drugs, he or she deserves the investment of the state in order to have a better life and a longer life. Okay, so this is the kind of statement that the strategy included. And this is, in our view, this was only possible without criminalizing people. So if it's completely incoherent, if we consider that we are dealing with a disease, a health condition, a chronic relapsing disease, how can we put people in jail because they are sick? So we started to compare, okay, this is a health condition with the same dignity of other health conditions. Some of them we can consider self-inflicted. Okay, so it's diabetes or some sorts of diabetes. If you eat too much sugar, too much, you probably become a diabetic. But nobody will put you in jail because you are suffering from that disease. So this was the kind of thoughts that we had. So, and I must say that as everybody had someone very close to the family with these kind of problems, this kind of mindset was a bottom-up movement towards the criminalization. So the strategy included that proposal.
So we have a health service which is quite well developed, supported by a decrim effort where people no longer feel stigmatized and feel like they do not need to worry about police going after them. So, but there, and you have a group of people that politically support the idea. There must have been someone that didn't like this idea. I mean, I can imagine that criminal justice, that there was tension between criminal justice and public health. So can you talk a bit about that? And so, you know, how long did it take you to bring them along? And what's the situation now as well?
Okay. Well, in the community, I would say that the idea was very well accepted. We, the members of that commission for the strategy, we organized a huge number of public sessions to discuss it. And what I get from that period was a huge support from the common citizens to the idea of the criminal rights. But the strategy was adopted by the government as a complete package, but the issue of decriminalization had to be discussed at Parliament because it's not within the powers of the government. And it happened 1 year later. At the Parliament, things were much more complicated than among the common citizens. There was a bipolarization of people supporting the idea and others with some kind of arguments. Okay, Portugal will become a paradise for drug users from all over the world. We will have planes coming to Lisbon every day with people to use drugs. Or our children will start using drugs with the milk bottle. Or the treaties, the United Nations treaties, all they impose that we use criminal sanctions. That's not true. They only prefer a prohibitionist paradigm, but not the presence of criminal sanctions to it. So, but in the police side, people were not very happy. Mostly because they were going to lose a source of information to deal with trafficking activities. But I must say that nowadays they are the happiest guys in the world. Because the way that we did it, and I will explain a little bit how it works in practice. In fact, the police authorities got rid of all the mass of beer users that they sent to the health side, and they could address their attention and their means and their time and their budget and everything to the sharks, to the big criminal organizations. So they improved a lot their efficiency. They used to seize by the end of the year. They showed the results. They had some kilos of substances. Nowadays they show tons, because instead of picking people on the street, they pick containers in open sea with bulk amounts. So nowadays they are the happiest guys.
So I think for sort of to make sure that everyone understands, can you talk about decrim in practice?
Yep.
Means in Portugal, and just to let you know where we're going, I'll ask you to talk about if I today get stopped in Lisbon for possession of a small amount of heroin, how small of an amount and what that means in practice for me. And then I will ask you to actually show us some evidence.
Okay.
Almost 2 decades later, what is it that we now know from the Portuguese experience?
Okay. Well, in practice, our law defines the limit for the amount of substances that you may have on you without incurring in criminal sanctions. Okay? I must say that using drugs and the possession of drugs in Portugal is still prohibited. It's no longer a crime. Okay? So, in practice, someone is caught by the police using heroin in a public place or in possession of heroin. Okay. The police officer will take you to the police station, apprehend the drug, weight it, and if you have more than the amount that is considered adequate of that substance for personal use for 10 days, if you have more than that, you go to the criminal system as before. Okay? You go to court, to before a judge, you have a trial, okay? If there is evidence that you were selling or trafficking, you may end up in jail as before. If you have less than amount, there's a table with different amounts for different substances. Okay? If you have less, you are sent, you are intimated by the police officer with just gives you a piece of paper. You must present yourself before an administrative body, which is called the Commission for Dissuasion of Drug Addiction, under the Ministry of Health. Okay? So you must present yourself in 3 days, and then you will be confronted. First step, you will be informed. The Commission will tell you, okay, it's still forbidden to use drugs in Portugal. It's not legal. Okay? It's no longer a crime, but it's forbidden. You can compare it to the use or not use of the safety belt. Okay? If you do not use the safety belt, the police may stop you, apply you a fine, or impose that you attend a training course for drivers. But you do not get a criminal record that stands for life and stigmatizes you for life. You never end up in prison because you are not fake. So I like to compare these two situations because in fact we are considering something that is in the interest of your physical integrity. So, well, you have less than that amount. You are presented to the Commission. We have 18 commissions. We have 18 districts in Portugal. We have one of those commissions on each district. So the person must present the commission of where the place where he lives, and then he will be discussing with the Commission what kind of use, what kind of relation does he have with the substance. Are you an addicted people? Are you in need of help, in need of treatment? And the Commission will offer you a gateway, direct gateway for treatment. It only works if you have treatment available. Okay, so I can tell you, okay, have you ever thought of treating yourself? Oh yes, but it's so complicated. What about tomorrow? Let's start tomorrow. Do you want an appointment? Okay. I have an appointment the next day or same week. Okay. It works, of course, if you have enough capacity to absorb these people. But you are free to say, no, I don't want anything. No. Well, okay, then your file stays open. You are informed. It's a misdemeanor, but you are informed. If you come back in the next 6 months or 1 year, I will have to apply some penalty. Okay. And penalty may be, for instance, to impose, to forbid you to join some people or to attend some places. You should not attend that cafe or disco. You cannot join that group of people. Or you may have social work to do, or forbidden to travel abroad. Long list of things. But if you are not an addictive people, even then, the attempt of the Commission is to assess what kind of needs do you have. You tell me, okay, I don't need any kind of treatment. I only use cocaine on weekends with friends, or I take ecstasy pill to go to the disco, but I'm functional. Okay. Anyway, if the Commission identifies any kind of factor in his life, his social environment, and so on, something that may lead this person to have later more problematic use. The goal is to identify that factor and to address the person to the adequate responsibility in society. So, a network of services that can be that can absorb those needs is needed. So, as I was talking too much.
So I just want to make sure that we get to the slides, the few. Because I think they show well, so we know the history, we know how it came about, and so let's look at sort of the data. Because I think many people sort of when they question the approach, they want to know, so what's the data?
No, I only bring you some 5 or 6 slides with some results. Of course, we could discuss it through your day, but I will start with the drug-related deaths. Since 2008, prior to that date, we had, in the 90s, we had almost 1 overdose a day. That means 360 something. But directly comparable data we have since 2008 with the same criteria. In 2008, we had 94 overdose deaths over the year, over the country. In 2016, we had 27. This is the lowest rate at European level. Those in blue are drug-related deaths, car crash, where drugs were present. But directly overdose deaths, we had 27 in 2016. This is HIV infection. The red line is the infection contracted through injecting drug use. As you can see, in 1997, 98, the situation was dramatic. And then there's a fall. You can see the green line, it's green or yellow, of infections through heterosexual contact, and the blue, I cannot understand what is called. The blue, homo or bisexual. So, if we consider those 3 groups, injecting drug users are the less attained by new cases of infection. New patients by year, we could absorb all those who were seeking for treatment. In 1999, we had almost 10,000 new patients in our system. 2016, we had 2019. So the pressures self-seek for treatment and referrals to the clinician, all that we can offer make treatment for everything. We are absorbing more and more areas of work. We included also problems in our mandate, and recently also gambling, screen dependence, because we have the capacity to deal with all those addictions. Main substance in the laboratory public network. As you can see, on red there's heroin, there's a fall in new users coming to the services. Cocaine is quite stable, and the treatment demand for candidates is increasing. So, in relative numbers, of course, there's a huge decrease in heroin. All the other substances only come 5% of the treatment demand. HIV use in the past 12 months. You can see the bottom line are the new comers to the services. In 2010, we had 11% of them were using intravenously. In 2016, only 4%. The upper line is that of relapse, people who relapsed. And I must say that during the financial and social crisis that we lived a couple of years ago, we had a lot of relapses of ancient users that came again to the intravenous foods use. Since 2001 to 2017, we had 121,000 offenders, different people that were present to the commissions. 64,000 were evaluated as non-problematic drug users, but even then, 19,000 were referred to other kinds of support, social support, psychological support, not from centers for the treatment of the addiction, but to other services available in society. For those 13,600 problematic, evaluated as problematic drug users, 10,000 accepted to be referred to treatment centers, and 8,070 something accepted and initiated treatment procedures. So this is a supplementary gateway. People can go directly to the treatment centers that are available without constraints, without waiting lists, for free for everyone, even for foreign people. If an American citizen is in Portugal and needs help, can just, nobody will ask for insurance or whatever. We are poor country probably because we would seem like that.
Those are absolutely amazing statistics. They talk about 27 overdoses in a year. The same year in New Jersey, we were over 2,221 overdoses in comparison. Low HIV rates, injection drug use in New Jersey, 40% HIV rates. And as far as access to treatment, I'll tell you a quick personal anecdote. When I went to Europe for treatment, they said, you don't want to go to the hospital and you decide to get into treatment. It's never good. And really, unfortunately, saying, we'll let people are citizens. Thank you. We're going to go right to our expert panel right now. And let me introduce, starting with Tess. Tess is a staff attorney with the ACLU of New Jersey, formerly of Human Rights Watch, where she wrote the National Joint Human Rights Watch and American Civil Liberties Union petition on supporting drug criminalization. That report is called Every 25 Seconds, the Human Toll of Criminalizing Drug Use. And we also have Carol Katz-Beyer here with us today, a friend of mine. She's a co-founder of Families for Sensible Drug Policy. She is inspired by lived experience and personal loss of her two sons, Brian and Alex, to fentanyl-related overdoses. She believes that the best practices that are readily available in physical health care should also be available for substance use. So we're going to allow each of our panelists to start out with 3 5-minute statements. Maybe Tess, you want to lead off?
Sure. I'm going to guess that you all were born after the war on drugs was declared. We're beyond our 4-decade mark right now. But having grown up in the war on drugs, I'm also going to guess that you all know from firsthand experience and also from picking up the papers or tweeting the Twitter sphere that the war on drugs has failed. Right? I don't think any of us can pretend that rates of problematic drug use are lower now than they were, in the early 70s when the war on drugs was declared. We also know that the war on drugs has had enormous human consequences, devastating human consequences, right? And that it's funneled people into the criminal justice system and fueled mass incarceration. We lead the world in our incarceration rates. As you all probably know, we currently incarcerate 2.3 million people in the United States, and here in New Jersey, our incarceration boasts or disappoints with the worst racial disparities. A Black person is 11 times more likely to be incarcerated than a white person. Right, so those are some bad statistics as compared to the ones we just saw on the screen here. I was born also after the war on drugs was declared, and I was a kid of the 90s. So I went to elementary school with a DARE officer. Have any of you heard of, do you remember DARE? Right, so I had a police officer who came to my classroom in middle school in upstate New York every week and told me that drugs would kill you and they were horrible, and if you did them, you would be arrested by him and end up in jail. We also, by the way, saw him downtown smoking pot, so his credibility was lost a little bit on that. But it was drugs are horrible and you will go to jail, so don't touch them, right? And again, this sort of abstinence only, as in many other contexts, doesn't work. Again, I think we all, or too many of us, have been touched by loved ones or ourselves who have experienced what harm a criminal justice approach to drug use has caused. And I sort of share that 1990s experience with you because as I was in law school and coming into the legal profession, I just sort of assumed that that was the way we did things, right? Like certain things are criminal and certain things are not, and I know the criminal justice system itself causes harm, but I hadn't really questioned that a criminal justice approach was the right one to take. And then I started talking to people, and as Randy mentioned, I talked to 366 people for this report, including a lot of people who were in jails and prisons for personal drug use. And I also crunched the numbers, and we discovered a few things. We discovered first that drug possession, so possession of small amounts of drugs for personal use, is the single most arrested offense in the United States, which I think is shocking, right? I think when you think about sort of what you want your police to do to keep you safe, it's not arrest for tiny amounts of drugs for personal use. And yet cops around the country are arresting for personal drug use more than any other crime, right? More than all violent crimes combined. And half of those arrests are for marijuana. Hence the title of the report, Every 25 Seconds, because in the US, someone is arrested for their personal drug use every 25 seconds. So I've been probably hitting my 3-minute mark already. That's 6 people arrested already just for their personal drug use. The other thing we know is that that's not helping anyone, right? The criminal justice system itself, I would submit, is incredibly harmful, right? No matter what you're going in for. But certainly when it's related to personal drug use, the harms of an arrest, the harms of pretrial detention, when you're not in New Jersey, which is an enacted bail reform, right? But in most states around the country, the harms of sitting in jail because you're too poor to pay cash bail, the harms of a conviction. In 42 states, personal drug use can be prosecuted as a felony, right? So an indictable offense here in New Jersey. The harms of that conviction, which stay with you for the rest of your life and keep you from getting jobs when you have to check the box or talk about it in an interview, that keep you from accessing public benefits such as food stamps in many states, that keep you from renting a home when the landlord wants to run a criminal background check. Right? The harm of incarceration, if you're punished with jail or prison time, the harm of probation or parole when you sort of continue your punishment even though you're outside, and the impact on your family is extraordinary. So I would submit that just the criminal justice system involvement itself is harmful. And then finally, we know here in the U.S., as I referenced, that it hasn't stopped problematic drug use, right? That rates of overdose and fatal overdose deaths have skyrocketed in this country despite a criminalization approach, and that the stigma associated with it has actually driven people underground, so that people are afraid to call the cops when there are overdoses. People are afraid that if someone dies when they're watching, that they'll be prosecuted on homicide charges, which is possible here in New Jersey. So we have a system. The whole point of what I'm saying is our system is so broken. There are other ways of doing it. I think Portugal shows us one such way. The studies after 2 decades, I think, are beautiful and incredibly inspiring. right, that not only has drug use itself not skyrocketed, in fact, it's decreased, and also they've saved lives. So I think there are real lessons to learn from Portugal. I hope that New Jersey and other states around the country take those seriously, and I would love to answer questions from all of you.
Thank you, Tess.
I've been waiting a very long time to meet you, and I applaud you and everything that you've done for Portugal, and I look forward to your sentiments and your vision becoming something that can become a reality here in the United States. Cassia, I know your work from Open Society, and I thank you very, very much for all of your efforts, Tess. It's a pleasure, and I just want to echo, as an impacted family, these are my guys. So this is Brian and Alex, and that's Devin, and I'm the one that'll probably tear up here, but Devin's the only one who's here. And Brian and Alex are missed. It's only a year since I lost Alex, and 2 years since his brother died before. Both of them were lost to fentanyl-related overdose, and I should tell you a little bit about the celebration of their lives. Brian went to Johnson & Wales for hospitality. Alex graduated Full Sail University with a degree in entertainment business. They played soccer, they played music, they loved life. Brian got married. Alex was doing restorative yoga, something that he said he would never do. And as a person who's worked in healthcare, supporting physicians in their practices and leadership empowerment and building networks and delivering an exemplary guest and patient experience, I saw something very wrong from the moment that they were identified as using drugs in school. Because what I believe is that they, along with many of their friends, were experimenting only, and because of the zero tolerance policies, they were taken off the soccer field. Alex was captain of the soccer team. They were diverted into an intensive outpatient program where they were forced to identify as addicts who were powerless, and they were sent to programs that compelled them to attend meetings without any benchmark goals, not supervised, where they fell into a more predatory circle of peers who then became faces that would introduce them to harder drugs, to as many were court-ordered and already in the criminal system. So my boys became immersed in this new reality, and we did everything we could to follow the advice, which included tough love, which included using law enforcement. The meetings that we were told to go to directed us all to use law enforcement to actually search for drugs, test for drugs. Our whole life became about drugs. And my boys went through the teenage years, and they found their way to college, and they did wind up in and out of recovery, helping people in and out of recovery. They wound up in Florida, which was the Wild West city of corruption, debauchery, and an addiction treatment industry that operated as the industrial complex arm of law enforcement. Everything was about compliance, arrest, and in short order, my boys became statistics in the detox, the not-so-sober homes, the corrupt labs. We only need to look at the headlines and see what's going on. The doctors that are arrested, the lab technicians that are arrested in Boston, I think there were 21,000 results. That these are people's lives. And I look to you as law students, as I look to their brother, who graduated with a bachelor's degree in criminology, cum laude, and went to visit his brothers on the day of his graduation in the cemetery. And I look to you with invigorated and renewed hope, and with a presence of carrying the torch. And I vow, in the honor of my boys, to work through our organization, which is Families for Sensible Drug Policy, because my story is the story of countless families who bear the ardent testimony that I just shared. And I very, very much appreciate your presence here, and I thank you all for everything that you're doing to make the world a place that is different than what we see on the news, not divisive, not full of hate, rooted in compassion and science and values that we can all embrace and get behind.
You encounter a parent who has a son or daughter who's addicted, oftentimes you'll hear them say, I want them arrested in jail or I know they'll be safe rather than on the street using drugs. How do you address that? What do you say to them?
Well, it's something I can very much relate to because I was told the same thing, that jail, staff, and institutions were the only option. And I never thought that as a mother, I would actually be saying, yes, we need overdose prevention sites. But I'm saying it, and the reason I'm saying it is because if we look at substance use like any other health condition, there's a continuum of care, there's prevention and education. We hope everybody will put their bicycle helmets on. We hope that everyone will use condoms. We wish that our kids would not use hard drugs, and at least that's what my mother always told me, not use hard drugs. But we know that in a condition where relapse is expected, we do not have a continuum of care when the streets are flooded with fentanyl to provide for a likely scenario, which is what happened to my boys when they were a lot closer to abstinence than they were to using. And because their resistance is so low and they're open to overdosing, it can happen very quickly even with one encounter. And we simply cannot allow that to happen. It's so far from normal for you to lose siblings, peers, for our nation to be suffering from moral despair, where at age 50, the most likely condition for a young person to die from accidentally is overdose. That's a problem. It not only is a problem, but it's unacceptable that we don't do something about it. And we have the template right here. We have the blueprint. We know what to do.
Thank you, Carol. That's something that hands over to you, but I know there's a lot of experience on the panel, so Carol, Kasha, Dr. Lally, you want to chime in on this? We heard about racial disparities in drug use, right? I'd like to hear something about gender as well. What are the impacts on women of drug utilization?
So I think there are a few. I mean, I think that the general average in the criminal justice system, more men are caught up in the criminal justice system, and as a result, it means that women are often forgotten. Right, we have the horrific example of the women's prison here in New Jersey. So I would just sort of say, as a general matter, it's important to continue to think about women. I would also add that gender, of course, is not binary, and so there's a whole other panel we can have on trans rights and affirming trans lives. And I'll say that in a further context. I think women tend empirically to be caregivers more often than their male or gender-identifying male counterparts. And so we see with criminalization some young mothers, for example, in my research, who were incarcerated pre-trial on tiny amounts of drugs, literally from a party. I met one woman who I call in my report Nicole, who was just shy of her 30th birthday. I met her in the Harris County Jail, infamous jail in the Houston area, and she had been caught literally with a straw. Very why the police decided to test the straw, but they had found a little bit of residue inside the straw, and they charged her with a felony instead of charging her with misdemeanor paraphernalia. And so she was locked up pre-trial before she was basically forced into taking a plea. She had a young child. She had a number of young children, including a baby who learned to sit up while Nicole was incarcerated, and was brought to see Nicole in the jail as an infant, but couldn't reach out and touch her mom because her room visit had to figure out how to make noise through the phone because that's the way he talked to her family when he was incarcerated. And Nicole eventually pled to this felony, and it was her first felony conviction. She had to drop out of school. She was getting a master's in business administration, but was relying on federal financial aid, and with a drug conviction, he no longer qualified as FAFSA, so she had to drop out of school because she lost her financial aid in Texas, and then she was disqualified from the SNAP program for food stamps for about a year, I think, and she was relying on that to feed her younger kids. She was on a lease with her husband. Luckily, her landlord allowed her to finagle it, so she just took her own name off, right? But if she didn't have her husband to rely on, she would have also lost her home because she wasn't allowed to with the felony conviction. And it was just this literal straw that the police have found somewhere after the test for the drugs. So I think these like heartbreaking stories, not just with individuals and individual loss, but family losses, especially with caregivers and mothers, is something we should all continue to discuss.
So Wendy, if I may, let me just offer one more. I repeatedly look at experiences of women who suffer from laws which were enacted with a question, what about the children? And you know, I want to be optimistic, and I want to think that those legislators at a state level genuinely were worried about the children, and were not meanly putting systems in place to go after women. But it's actually very difficult to keep that optimism when you see what happened. How, you know, women who tested positive for substance during delivery have their kids taken away. There's a whole list of grievances, dramatic grievances at a state level, which really are unacceptable. And I think what ends up happening is that actually those intentions of what about the children are actually making things worse for children. Because then moms are, you know, kids end up in foster care, moms end up harassed by the criminal justice system, in the worst case scenario end up in jail. So again, I really sort of encourage you to think twice or even more when you hear that question, what about the children? Because I think under that, with that intention, it's where laws that really dramatically disadvantage women are put in place.
Carol, why don't I ask you this? In New Jersey, a lot of programs like to kind of say they're almost decriminalization. Drug courts. Well, we're not going to put them in jail through the forced treatment act, but they start their best. The Blue Heart program, come to police stations, surrender your drugs, and you'll get treatment. We're still allowing people to be arrested for drugs. Can you speak to clarify the differences that you see, and in an ideal world, how people use drugs to be treated? And just clear that up. Criminalization when these programs are there.
Yeah, sure. I've participated in a lot of different council programs with my local municipality, and I've had an opportunity to hear the prosecutors and the DAs and the DEA agents speak. And it sounds wonderful. Essentially what they express is that they want to get the dealers. They want to help the poor suffering addicts, and they want kids to be able to get treatment, and all the parents cheer. Why wouldn't they? You know, they're here, they're protecting my kids. In reality, though, what we're dealing with is we're working with Women's Law Project in Philadelphia, and we're working with other agencies to break down what the legislation and the laws really provide. And in a fentanyl-related death, they can go after, and they are going after, we're seeing a lot of overzealous prosecutors go after friends who are using with friends. One is always the user, one is always the dealer. They may switch off roles. Neither one intends for their friend to die in an overdose. And the Good Samaritan laws that were in place, you know, might as well be off the books now, because who is going to call in the event that a friend dies if they're going to be charged with murder? To answer your question about the drug courts, again, that sounds wonderful, but what the drug court does is it basically, and I'm sure you could speak more eloquently about this, Tessa, I'm a little intimidated, but I'll try, so you correct me if I'm wrong. They basically say, okay, we're going to give you a break. If you can go through the drug court, we're not going to give you your full sentence, but we're going to hold it here in case you happen to use, we have the discretion then to impose the full sentence. So knowing that relapse is expected, the likelihood that that person will not be able to remain abstinent in a drug court is very high. So it's all semantics. It's like a package that is very well rehearsed. It's the same way with tough love, let them hit bottom. You know, and as a person who could write the Zadig book on rehabs in South Florida, I can tell you that most of the addiction treatment industry is working in conjunction with law enforcement, and the compliance-driven protocol is what is driving quote-unquote treatment under the guise of health, which it's not health, it's handcuffs after the agreement.
invested that those resources into treatment and site treatment that was truly available, that was not coercive. And I think that's a really important lesson that models like drugs work fail to teach.
And just to pinpoint that Alcon Handcuff's analysis did share its own stats on the article, show that it was 78% failure. Not only that, 125 people have died in that program over a 5-year period, and the program is caught in state audit over a community